background in this study, of course, is that anxiety is a really common behavior problem in dogs. Of course, unruly behaviors are probably one of the absolutely most common behaviors, but unruly behaviors are normal dog behaviors that people don't like, such as jumping up on people to greet them, digging in the yard, even trying to play too boisterously with 5-year-olds, etc. Anxiety-related behaviors are abnormal dog behaviors, and what they can look like is variable depending on the trigger and each animal's intersection of genetics and environment. So in veterinary behavior practices, it's actually probably the most common diagnosis at this point. Now, there may be specific types of anxiety disorders that get diagnosed in a behavior practice, like people often are familiar with separation anxiety. Also, social distress can cause fear-related or anxiety-related aggression in animals, and certainly we can have avoidance. For instance, those animals that are fearful of specific people in their home. Often any males in the home are the targets of this behavior, but it's not always male specific. And of course, anytime the animal sees something as a threat or possible threat, these are things that can really feed into an animal's underlying anxiety disorder. When animals are dealing with stress, there are a variety of different ways that they can attempt to cope with these stressors. One is to sort of habituate to the trigger, and the other is to escape. The problem is that this isn't always an option. When animals are confined and cannot escape and are having difficulties learning to cope with the trigger, what we can find is that we get this increased heart rate, increased respiratory rate, and while it can happen in many species, dogs are particularly famous for having impaired gastrointestinal function, such as the sort of famous stress colitis in dogs. When we have this level of stress that an animal isn't able to functionally cope with, we can end up in a situation where the patient is either anxious in a specific trigger situation or even generally anxious. The diagnosis for an animal that's generally anxious is generalized anxiety disorder. So when we treat anxiety, regardless of the cause, what we are trying to do is attempt an applied behavior analysis of what we are seeing with that patient. And using that information, we create an individualized behavior modification plan. That will involve teaching the animal to be able to cope better through these trigger situations. However, we're also going to do environmental modification. And sometimes if the situation is bad enough that the patient is suffering or the family is suffering or the patient is at a risk of injuring himself or others, we're going to consider adding in a medication and also really look at these other, what I would think of as ancillary therapies. Of those therapies, such as pheromone treatment, other supplement products, the application of pressure definitely comes into play.